All right, good afternoon, everybody. Here's to a stormy Thursday afternoon. I'm with Josh and Paul and Deirdre and Miriam Delphin-Rittman. Miriam, as many of you probably know, oversees mental health and addiction services, the commissioner for the state of Connecticut. And she's here because we're going to talk a little bit about a lot of the stresses that folks are going through and how we're helping people deal with that. There's been a lot going on, obviously, between COVID and the economic stress, not to mention the storms. And here we go again. As you probably just heard, there's a tornado warning in Litchfield. We're getting hit pretty hard here in Hartford, where we are right now. Sort of ironic that the Eversource public hearing is going on right now. Hope we all can keep the lights on. And hope we're better prepared this time than we were a few weeks ago. We met with all the municipal officials, virtually yesterday, just the stories they had about the last storm and one guy getting caught in the car when the tree came down and the hours it took before he could get rescued. So it'll be an interesting public hearing. But first, let me start with where we usually do, which is the COVID daily summary. Again, I think relatively good news. First of all, let's look at the number of tests performed. That's 15,000 plus tests. That's a run rate of over 100,000. So while the CDC is sort of saying maybe we can throttle back on the amount of testing we're doing, we're ramping up. The positivity rate, 130 out of 15,000, that's less than a 1%. It's about 0.8%. I think we're at about 0.7% for the week, give or take, so I think those numbers are good. As we talked about last time, we've had some concerns about some flare-ups, probably the most significant of which was Danbury, where Josh and Deirdre and the team really brought in the bucket brigade to douse the flare-up as best we could, did a massive amount of testing. The populations there were great in terms of testing, in terms of quarantining, allowing us to track and trace. So we're not out of the woods by any means, but the positivity rate in Danbury has gone from 7%, where it ramped up, to now about 5% for the last cycle. So fingers crossed, and maybe this is a template of how we can do things right going forward. But we are maintaining our commitment to testing. We announced this with, again, New Jersey and New York. We're going to test symptomatic and asymptomatic people, and it's really important. Obviously, an asymptomatic person can be just as infectious or more infectious than somebody who is already symptomatic, and there's no waiting to do this. It's working around the state, and we're going to keep going. If you've had contact with somebody who tested positive for COVID, get tested yourself and quarantine for 14 days. And as you can see, we're now in a position where we're doing testing on a regular basis, so that you can get tested, say, on a monthly basis. And that allows us to give some consistency in terms of what we need to do. We're really focusing on the high-risk facilities. As you probably remember, down at Danbury, after the flare-up there, we went into the nursing homes, tested everybody, and do that on a weekly basis. Norwich was a similar circumstance where there's a flare-up at a nursing home. We caught that early, and hopefully that is contained. Remember, tell everybody it's free. You can go to a federally qualified health center. You've got symptoms, you don't have symptoms, it's a free test and it's worth doing. And dial 211, you're going to hear that number a lot. Dial 211 or CT.gov coronavirus. You can find a location closest to you where you can easily get tested. We're maintaining our commitment. You know why? We're doing that because we're sticking with what works. And I think you can see that when we first began our reopening on about May 20th, where the numbers were in terms of infections, and in through our June 20th reopening. We've done this cautiously. It really has worked. You can see that 10% number there, where more like 1%, but 10% was the break point for people or other states due to quarantine. I think there's relatively good news there. Rhode Island was briefly on the chart. They're off the chart. Delaware, Maryland, states that were sort of in our orbit, so to speak, which we worried about, are now below that 10% positivity rate, and that's extraordinarily good news. If you have a cousin from Guam, unfortunately, please tell her don't visit right now, or if you visit, you will have to quarantine for 14 days. That's one place that did land on our list. This next slide is interesting to me. It just is an example. Max, you have that up? It's an example of the outreach we are doing to all the different communities around the state. In different languages. You see it in Spanish, you see it in, hear it in Polish, trying to register with people in different ways. If you wake up and you can't smell the coffee or the bacon, go get tested, because losing your sense of smell is an early indicator of what's happening there. So we've done a real outreach effort to all the different communities, and I'd like to think that it's working. You know, here's on a different topic right now. Look, the country is getting hit hard on an economic front, and we've got about 95% of our economy technically open, but that doesn't mean everybody's going at full throttle, and that certainly doesn't mean everybody has been hired back. We have a tough unemployment situation, and as you probably know, we did get the permission from the feds for the $300 true-up, which is a good start, but Department of Labor says it'll probably take a few weeks before we can get that reflected in your unemployment check. It will be retroactive, which is a relatively good news. But this is sort of the economic resilience chart here is interesting. It tells you how much of our economy has come back. And nationwide, our economy is about 22% less production than we had pre-COVID. That says 78%. Connecticut is relatively better off. We're at 81%. We have a way to go. This is no victory lap, but we're at 81% of our economy came back. New York is at 71%. New Jersey, 79%, Massachusetts. You know, I think a number of reasons for that. One, we kept our manufacturing open. Secondly, we kept outdoor construction open throughout, so that allowed us to hit the ground running. We kept our stores and restaurants open, at least for pickup during those early days. We have a long way to go, but it just gives you a sense of how we measure up compared to our peers. Finally, I think because we're doing relatively well, Deirdre's really been taking the lead on this at our nursing homes. We're trying to make it easier for you to see a loved one there. And there are a lot of reasons for that. I was the guy that had to make a call in early March that we no longer were going to allow visitation into our nursing homes. I think you know what the purpose was there, in trying to do everything we could to tamp down the risk of infection. A couple of months later, we were able to at least open up for outdoor visitation with a loved one at a nursing home. And what Deirdre's doing now is opening that lens a little more, because we know that we can do that safely. And so facilities will create their own visitation plans, but most importantly, you can spend a little more time with a loved one there as necessary. Compassionate care, you know, in the facility itself, in the room, somebody in real need, we're making sure that's available. And also it promotes emotional health and well-being. And obviously in the Alzheimer's clinics and places where people are losing a little bit of touch, having that lifeline with a loved one was so important, and we're opening that up a little more every day. And that gets us to where we are on emotional, social, and that's mental health and substance abuse, substance use resources. That's why Miriam is here. I can just say, as I've said before, our 211 hotline is just a window into what is going through people during this time of incredible stress, you know, power, COVID, economics, and we've seen that. One of our, you know, first early detection systems was, you know, go into the emergency room, go into the doctor, going to the school. A kid would report back on what's happening back at home, and those were closed down for a while, and that created even more of a sense of isolation. And we're obviously, as we reopen our schools, you can go see a doctor. The emergency rooms are open. you can go and you can get the love and support that you need. Mary Ann and I were at CCAR, that's the Community for Addiction Recovery. Saw an amazing young recovery coach there, a young man who was just on death's door. He showed me the picture, and then we talked about the dozens of lives that he has saved since then. So Mary is just going to tell you a little bit about what she's hearing in terms of mental health and substance use and what we're doing about it. Mary?
Yes, thank you, Governor. Yeah, so, certainly one thing I'm hearing is that, we all know that this is such a stressful and difficult and challenging time. Hearing a lot that, people are just feeling stress related to the uncertainty of, their own health or maybe health of family members. We're seeing an increase when we look at our data, even an increase in some of the overdose rates within the state. There's been national data that also showed an increase in some of the suicide rates among young people. So certainly one thing that we have been sort of focused on and working on is really trying to get information out to let people know about the services and supports that are available across the state. We have a very robust service system, and in many ways our systems and many of the programs and services and state providers, as well as our community private nonprofit providers, have stayed open through COVID. And so there are just a few resources that I do want to share and then talk a little bit about just some of the signs, what to look for, when to reach out and call 211, for example. So I'll go through some of the resources. So for example, we have a mobile crisis team. We have mobile crisis teams across the state. And so 211, so appreciate the collaborations with 211 that really is the central call line for our mobile crisis teams. If somebody is in crisis, an individual or family member or a child even, you can call 211 and 211 will send out a mobile crisis team to be able to do an assessment and help to triage and connect either the child or the adult to the appropriate level of care. We also have our access line, and this is our access line to help people who may be struggling with substance use disorders. This is a line where a person can call, so the number is 1-800-563-4086. If somebody is struggling with substances, they can call that line, receive an assessment over the phone, and be connected to the appropriate level of care. So whether they need detox or residential or some other level of care. The thing about the line is we will also come and give somebody a ride to detox. If they need detox and don't have transportation, we will go and pick them up and give them a ride to detox. And it's safe, the appropriate PPE will be available, and so that is something that we're really committed to and have maintained throughout the COVID crisis. Another resource I want people to know about is our liveloud.org website. Live Loud is our centralized sort of website where there are a range of opioid and substance use related services, information about those services and supports. We have a new function that I'm excited to let people know about that's part of Live Loud, and that's the live chat function. So now an individual can actually connect with a recovery coach and have a conversation with another individual in recovery about what they're experiencing or feeling. And so that's something that we added to the Live Loud website. Another thing we hear is that young people are really struggling. So for youth who maybe miss some of the transitions, the graduations, or missing playing sports, or missing some of the social gatherings with their friends. We have a group that we fund, Advocacy Unlimited, and they have a website and some called Join Rise B. And the Join Rise B sort of group and team, they actually have a warm line as well. So if you go to the website, there is a warm line for young people, run by young people. So if someone is feeling socially isolated or alone, they can connect with another young person through that line. NAMI Connecticut also does virtual support groups for young people and family members. And so that's an important resource that we have here in Connecticut. Again, because we're hearing that, being the social isolation for people is hard, and it's causing increased stress, which for some people may be exacerbating addiction or exacerbating some of their mental health issues. And so the NAMI Connecticut, has the virtual groups. And then also finally the CCAR, the Connecticut Community for Addiction Recovery. They run 5 recovery centers across the state. These are centers where people can drop in, can receive support, can talk with other individuals in recovery, can volunteer themselves. And so that is available across the state as well. I'll end by just noting that, as I mentioned, it's a difficult time, and I think, one thing we know that can make a difference, in addition to these resources here, and again, 211 is a great resource for connecting to any of the services and supports across DEMAS. But lastly, I think an important piece is just reaching out to each other. Place a call. If there's an older person in your family or friend or somebody that you know that lives alone, reach out and give them a call. Let them know that physical distancing doesn't have to mean social isolation. And I think to the extent that we stay connected with each other, place the phone calls, or maybe go out to lunch. Certainly masked and socially distanced can help to reduce the feelings of stress and social isolation that people may be feeling. So I'll stop there, and we'll be happy to take questions when we get to that point as well, Governor.
Yeah, especially on a stormy night like tonight. Give somebody you think might need a call. It's a good thing to do. All right, Max?
Channel 3 Eyewitness News.
With the services that you've listed, particularly those that are run by the state, have you seen any increase in calls or requests for service?
For certain services, we have seen an increase in calls, and it's ebbed and flowed. So our access line has continued to get some calls. People wanting information or, wondering how they can get into detox or where the resources are available. So that has continued to receive calls. Also 211. So 211 also helps to run our National Suicide Prevention Hotline. And they have reported an increase in calls as well. Although sometimes it's calls, not necessarily someone talking about mental health challenges, but people having questions about benefits, so employment or food benefits or housing benefits. And so we're hearing quite a bit about that. And certainly one thing that we're hearing as well is that CCAR, they're online recovery groups, that people are really accessing those quite a bit, that they've been quite popular. And in many ways, the online groups helps to create that virtual community. So I think that's one of the reasons why those have been pretty popular.
And I was also going to ask about what you're hearing from service providers. Are you seeing increased demand from them, whether it be online or in person?
So I think the question was, are we seeing an increase in demand? Many of our service providers are saying that people are continuing to use the services, especially through telehealth. So there has been some providers are reporting an increase. People are continuing to come in for either addiction services or other supports. Others are actually are reporting a decrease, that they're not seeing people come in at the same rate. Which is some of the reason why we're really working to get information out, that there are services available across the state. So we're seeing both. Some providers say they're seeing a steady flow and it's pretty constant, and others reporting either the same or a decrease. Across the board, the thing that's been very popular is the telehealth. For people that live in rural areas or for people who may not have access to transportation, the telehealth, being able to connect with their providers virtually is something that's been very popular, and that people have been advocating, actually, that we keep beyond COVID.
Yeah, CCAR, the addiction services, I think their demand is up about 20%. The number of opioid-related deaths is up about 20% compared to last year. Talking to Karen Johnmark on domestic violence, the hotline there up about 20% as well.
News 8.
Hi, Governor Stephanie Simoni here. I had a question for you based on Jim Judge's testimony today. Do you believe he should step down based on what you heard, and why or why not?
I don't think that solves anything. As I've talked about before, when it comes to Eversource, they've had a number of CEOs since Hurricane Sandy. A little credit, I tuned into some of the hearings, and the Eversource guys are on throughout, and they were taking their medicine. And what's most importantly now is that Pura work with the legislative team. We come up with a set of metrics. We tie performance to that and make sure everybody's benefit is tied to how they perform, not automatic.
Thank you.
NBC Connecticut. Fox 61.
Hello there. This first question from the commissioner, or for the commissioner, I should say. What should people do if they don't feel like they need the services to call in? What can people do in their daily lives to help with their mental health, coping with all the stress of this pandemic?
Yeah, that's a great question. I think just, one of the things I mentioned before is, staying connected, staying socially connected, reaching out to family members or friends can help with stress and anxiety. But then also some things like, getting enough sleep. We know getting enough sleep can certainly help to reduce feelings of stress and anxiety. Exercise. Exercise is a wonderful way just to physiologically reduce some of the stress hormones in the body and can help to reduce feelings of anxiety or stress. Deep breathing or relaxation exercises. That's also another thing that can help to reduce stress and anxiety. There's a recent collaboration between DEMIS and DEEP, so Department of Environmental Protection. So Commissioner Dykes and I now have a wellness series where we're streaming wellness activities from state parks. Connecticut, we are so fortunate that we have such beautiful state parks. And so our thinking is with this initiative, it's a way to introduce people to the parks, but then also a way to allow people to do and give people the opportunity to do wellness activities from their home. So tomorrow there'll be Qigong that will be streamed from one of the state parks here in Connecticut. And then next Friday, we'll be doing some mindfulness meditation, and that will be streamed from a different state park. I think paying attention just to some of those basic wellness things, sleeping, getting enough eating healthy, exercise, certainly all of those things can help with managing, wellness and day-to-day stress.
And just to follow up, Governor, a lot of the emails that we're receiving into the newsroom have people being very stressed out about their unemployment, being able to make ends meet, not being able to get in touch with state agencies, whether it's for child support or DMV services. What can the state do to help alleviate people's stress?
Well, first of all, on the unemployment, it's really time for the U.S. Senate to step up and make a deal with the House so people have some certainty about what they can expect. We're sort of putting together a patchwork when it comes to unemployment. I'm thankful that for the next couple of months, the feds are going to provide an extra $300 on top of the state unemployment contribution. Like I said, that's going to take a while. Fortunately, DOL has now been able to get their call service center up and operating. So I think they're much better able to, we've caught up for the past due. It took a little bit of time, and now we're able to take those calls as well. DMV, my understanding is that, I don't know if we've caught up necessarily, but we contracted out for a lot of the driver's tests and the such, so those young people trying to get their first driver's license are back on track. We're doing a lot of it remotely right now, but a lot more of our centers are open. So maybe there was a bit of a rush right after we opened them up, but now we're a month into it, so I think you'll find it pretty timely.
Thank you.
The Associated Press.
Thanks, Max. Good afternoon, Governor. Good afternoon, everyone. Commissioner Gifford, I wondered if you could talk a little bit more about the visitation changes at the nursing homes. Is this a blanket policy, or is this going to be tailored to each individual resident?
Hi, good afternoon. Thank you for that question. This is a policy that is not for every resident of the nursing facility. But it does impact the general way that nursing homes are handling visits. So let me explain in a little bit more detail what the new commissioner's order does. First of all, it clarifies that visits can take place more than once a week. Some nursing homes were interpreting our prior guidance to say you can only have one visit per week. That's not the case. Clarifies that. It requires that each nursing home develop a facility-wide visitation policy so that residents and families will be able to know here are the policies in the facility where you live or where your loved one is living. It requires each facility to assess the psychosocial needs of each one of their residents and develop a visitation plan for each one of them. So that will be important. It also extends the minimum time for visits, socially distanced visits outside or through a window. Those should be a minimum now of 30 minutes as opposed to 20. And it also requires that facilities allow visitation at least 5 days per week, and one of those days needs to be on a weekend. So that will improve access for families who may not be able to visit during the week. Probably the most important thing in the order is that we're expanding what we call compassionate care visits, and we're allowing families to visit indoors with their loved one who is either at the end of life or who has had a deterioration in their condition as a result of social isolation, and that's certified by a doctor. So as long as there's no COVID in the facility, those compassionate care visits can go on.
Do you expect this to open up even more, like in another month, or is it just sort of a wait and see thing?
Well, we know how important the visitation is to families and residents. We are acutely aware of the many, many families and residents who want to be reunited, but we're also very aware of what we saw in the spring with respect to COVID infections in nursing facilities. So we're taking it step by step. We think that this will address a significant number of the challenges that we've seen. We want to see how this goes, how nursing homes implement it, and then we'll look at it again.
And what is your reaction, and also Governor Lamont, what's your reaction to the decision by the Connecticut Interscholastic Athletic Conference on their plans to move forward with fall sports? I know DPH recommended that you guys hold off on football and indoor volleyball, I think.
Hey, Paul, why don't you take that?
Yeah, I'll start off, and then I'll pass it off to Commissioner Gifford. DPH has been shrinking of their recommendation based on the question of CIAC. I think one of the main aspects the government has been focusing on is to get our kids back to safe. We ensure that they're not issue of equity in terms of individuals in the educational.
Paul, your audio is cutting in and out.
Oh, okay.
Yeah, your audio is cutting in and out. Not sure if there's something you can do to fix it.
Okay. Pass it off to Commissioner Gifford.
Oh, you sound better now. You sound better now.
Sound better now? Okay.
Yep.
All right. Well, first and foremost, thank you for the question. Like I said, the Department of Public Health has been extremely clear as it deals with the overall guidelines based upon the CIAC's provide. Football is a high-risk sport that is categorized by the National Federation Association with the CIAC as a member. We do not expect EPA to change that recommendation. The governor has always stated the objective was to ensure that we keep our students back safely, so educational that not only they deserve, but institutions that they deserve. With that said, there's going to be local districts and parents to tell what are the various risks of in football the fall academic season. I think there's no surprise. I'm proud of a football player, both high school, collegiately. I have a son myself, and if I was in the position of a high school son in terms of playing football, I would have a lot of pause about whether or not it would be safe to play at this time. With that said, DPH was clear with their recommendation of volleyball and with football, following the overall recommendations and by the association is a member of. So DPH will continue to work with the CIAC But with that said, well, they're staying strong on their recommendation.
Go ahead, Deirdre.
So, I think Paul said everything pretty clearly. Our recommendations, as reflected in both of the letters that DPH has written to CIAC, are that we do not recommend going ahead with either high-risk sports, such as football, or moderate-risk indoor sports, such as girls volleyball. And as Paul reflected, those recommendations are unlikely to change. We've been consistent. And those recommendations are based not only on those national guidelines, but they're based on the nature of the sports themselves and the nature of the way that the coronavirus is transmitted. And as the governor repeats frequently, we're going to follow the science, and the science indicates that these sports are higher risk than others.
Thank you.
Connecticut Public Radio.
Good afternoon. I have a question on, Lamont, your executive order on testing at nursing homes says the testing can stop if a facility is COVID-free after 14 days. Now, do you still believe that's the most effective testing strategy, especially as we begin letting more visitors into the nursing homes?
I do, except in extreme circumstances like the Danbury situation. Because of the flare-up there, we've accelerated the testing in that particular nursing home. Anything else on that, Deirdre?
Yes, I would add, Governor, that as you said, the guidance also says that that DPH may change the recommendations from time to time. So we have changed our recommendations for Danbury to have every staff member tested every week. We are also going to be implementing a surveillance testing strategy where one quarter of the staff are tested every week. So it won't be every staff member every week, but every staff member at least once a month will be tested going forward.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Hey, can everybody make sure that they're muted? I'm getting a pretty wicked echo over here. I don't think it's the weather. Thanks. Governor, going back, we were in Danbury with you the other day. Is there anything in particular that might be attributed to the reduction in the rate of transmission there?
Like I said, I think the cavalry came in pretty hard, and we did well over 1,000 tests. That's a big piece of the population that we thought was certainly most at risk, those multi-generational in the denser housing. I'd like to think we got there relatively early, and as I said before, the people not only got tested, but they also quarantined. So we're not out of the woods, as I said. Let's wait and see over the next few days, but so far, so good.
Thanks. And I was listening to the Energy and Technology Committee meeting most of the day, and thanks for scheduling this at 4 o'clock so I didn't have to listen to it anymore. But would you support or call for some kind of rebate or reimbursement, even though Eversource and United Illuminating do not have to?
Yeah, I have privately said that to the CEO, and I've publicly called for it. Look, you could wait for regulation, you can wait for the legislators and see what they make you do. If I was the CEO of a company like that, I would say, look, I know the incredible stress people were going through. Maybe it was a hard storm, but we all know we could have done better. And it costs some of these folks a lot in terms of financial, in terms of food, and in terms of stress. So I would definitely lead with a refund. I think that'd be the right thing to do.
And finally, noting that there's some kind of Republican convention going on with the president, do you think it was just a coincidence that the CDC quietly came out with this controversial rule regarding people who should be tested and who shouldn't be tested this week?
I think it's a very political season, and nothing's a coincidence.
Thanks, Governor.
The Hartford Current.
Yeah, I had a couple of follow-up questions for Commissioner Gifford. Commissioner, on the visitation order, my understanding is that this will allow people to actually go inside the facility and be with their loved one with no social distancing, you know. Is that correct? Am I reading that correctly, or?
You are, under limited circumstances, that will be allowed. There will be a requirement for personal protective equipment, for symptom screening of the visitors. But it's the view of our team and the experts, and we've been consulting with the industry as well, that under certain circumstances, that is a safe practice and very important for the family and loved ones' well-being.
And following up on the testing issue, do you have concerns that some nursing homes have not been testing their employees as they have supposed to be?
We've actually been out and about confirming that, and that we have discovered a couple of nursing homes that were not in compliance with the governor's executive order on staff testing. So there will be some actions taken with respect to those facilities, and we'll continue to do those inspections to make sure that nursing homes are in compliance. It's a very important strategy to, we've been, with all great credit to the nursing homes and their staffs, we've been very successful in bringing down the number of COVID cases in our nursing facilities, and the governor's executive order on staff testing is a key part of that strategy. So it's important that we monitor compliance and enforce it.
Thank you.
You're welcome.
The Connecticut Mirror.
Thanks, Max. Good afternoon, Governor. I wanted to ask you about education funding, particularly. Superintendents were informed last Friday how much coronavirus relief funding they'd be receiving. Why did the administration decide since then to adjust those allocations?
I think, we asked people to give us proposals assuming in-person learning, distance learning, and some hybrid in between. I believe that they gave us their best estimate in terms of what they were going to need. We said we will fully fund everything you've requested in terms of masks and other PPE to make sure you can return to school safely. I think we said we're going to fully answer any questions or provide any funding you need for technology, just to make sure your classes are equipped. And as you know, we're getting Chromebooks and Wi-Fi out to folks that are in need there. I think if there are some other ancillary things they asked about, Melissa McCall, you know, maybe used a little bit of discretion there. And right now, you know, we're finding, look, some of the schools are opening full-time, some are opening, you know, perhaps New Haven's going to try distance learning for now, so there'll be some, you know, money following the children, because some kids are going to go to another school district, a magnet school in another town, if they can't go to school in their hometown.
Thank you. Just one more question for Commissioner Gifford. We're going back to the visitation at the nursing homes. Are there any specific triggers that you'll have where this policy could be tightened up? Like if, for example, the statewide positivity testing rate goes over 1% or some other mark, or if a particular number of nursing homes have breaches. Have you set any specific criteria for when you might and how you might modify this visitation policy?
Yes, so that's the case with all of these commissioner's orders, and you know, they're dependent on the circumstances, of course. In this particular order, we state that as soon as a nursing facility has an outbreak, which is just one case, we will discontinue the compassionate care visits indoors. So that's built into the order. And then, as the governor mentioned, we'll keep monitoring community spread. And when we think it's necessary, we can change these visitation policies. I want to make sure and say, though, that we do recognize how important visitation is to families and residents. It's part of their health and well-being. So we won't ratchet anything back lightly. But if it looks like it's going to be necessary, obviously, to protect the health and well-being of all the residents in the facility, we will do that.
Thank you.
CT News Junkie.
Thanks, Max. My first question is for the governor. Governor, Biden said that he would shut down the country again if scientists recommended doing so to fight the coronavirus. Under what circumstances would you shut down the state of Connecticut again?
Christine, I think we're finding here in Connecticut that we were able to open cautiously, and I'd like to think keep things open cautiously and keep the infection rate down. So I'm not talking about shutting things down, but let's face it, we saw in Danbury, if there's a flare-up, we said the schools are going to have to take a pause, and and the college will have to take a pause as well. So I think we're going to adjust accordingly, but right now I think Connecticut has learned how we can manage through this COVID pandemic without going back to closing everything down, but we're going to do it cautiously.
So where do we stand on phase 3 then?
From my point of view on phase 3, it's going to take a little bit longer. As I've talked to every governor, and I said before, a lot of phase 3 is related to upping the occupancy in indoor dining, for example. It's about opening bars again, big indoor entertainment venues, and even though our metrics are still very low, I'm highly conscious of how fast things changed in places like Florida and Arizona last month. So I'm going to err on the side of caution there.
Okay, and I just wanted to give Paul Mounds another chance to answer the football question and whether football should be going forward in the fall.
Yeah, can you hear me clearly?
I can hear you clearly.
Perfect. So as I stated before, the Department of Public Health, under the leadership of Commissioner Gifford, has been extremely clear that football is a high-risk sport. And that's not only a designation that the Department of Public Health has come to the conclusion of, it's also a designation now recognized by the association it's a part of the CIAC itself. So with that said, I do not expect the DPH to modify their letter or their conclusion. And at this time, the CIAC has been able to go forward and to follow metrics that will be seen in the state of Connecticut. If they have any further questions for DPH, they will answer it. But at this time, the recommendation of the department is that football in the 11-11 format should not be played in the state of Connecticut.
The Waterbury Republican American. The Waterbury Republican American.
Let me just say that try and find a silver lining on everything. We got tornado watches and big thunderstorms. Stay safe, stay at home. We did need the rain. There were drought warnings in the northern part of the state, so that's good. And I'm trying to put you at ease because, Miriam, you and I were there. We know some of the stress that people are going through right now, and there's no place I'd rather be than Connecticut right now. I think we're getting through this together. Thanks, everybody.